Okay, so here we go. This is the pre-recording for the week 2021, week 2 lecture. This is around impingement syndrome and thoracic outlet syndrome. We're really getting into this idea of space and flow with the shoulder, again, focusing on the shoulder this week. I'll review a little bit before we jump into all this new stuff, and there's just a ton of great stuff to get here. All very, very useful stuff around very, very common shoulder problems. I probably will spend some time next week on it, going back over it because I'm giving you so much, but try to keep up as much as you can, take in as much as you can, and then we apply it in the lab. It should start to kind of come together in your mind a little bit. Going back to last week, we talked about scapular position, scapular glide in lab. Looking for that good symmetrical scapular glide so they're both gliding the same as you watch them without winging, and one is not lagging behind the other. If they have that winging, it's coming out. How do we treat that? We strengthen the rhomboids to get it tighter up against the rib cage and that sort of thing, and more medial. If it's not gliding correctly, so it's kind of one's lagging behind the other for some reason, it has a poor glide, we can do some passive range of motion of the scapula. We did that. So 2 basic tools that you've got to do that. Somebody has forward neck. We talked about that, a lot of neck pain, chin tucks, wall lineups. We'll do more of that in work class. And we got into, in upper extremity, the manual work on the scalenes. Work on the scalenes and levator scapula, 2 key muscle groups in there. And those stretches. We had a scalene stretch and a scalene and a levator scapula stretch. So if somebody has forward neck, definitely address the posture issue with the chin tucks or some other exercises, and go after it manually, easily, because it's a very sensitive area. Do some massaging in there, or do some modalities in there, and do some stretching. Those stretches and isolate those muscles. Importance of scapular trunk range of motion on the shoulder function. If the scapula is protracted, it compromises the space. Remember how we tried to lift our arms up with terrible slouch, and then we had perfect posture, and we tried to lift our arms up, and the range of motion was dramatically different. Why is that? If you know the anatomy of the shoulder, when you're slouching, it's coming forward and pushing up against that acromion, the humeral head. If you have good posture, you have good space and good glide. Case videos around the neck. You can do that when I would jump in and do that first case video. I would leave all these to the end because you're just going to get snowed under. That one's pretty straightforward. If you go back to the treatment box, what I just talked about with posture of the neck, I think you can bring it together pretty quickly on that one. Space and flow. Talk more about that in a second, but this is kind of the focuses on the posture, what it does. It's a nice little graphic. Kind of inhibits the neck flexors, the scalenes, goes after levator. I wouldn't say it's the trap so much tight, but it's kind of on stretch, maybe too much. Everything in the front is tight. The pecs are really tight. And the guys that aren't doing any work, that need to do work to get good posture, the rhomboids and the serratus, kind of pulling it down and back, the scapula where it should be. Space and flow. What do I mean by space and flow? Again, it's that flow of blood, that artery blood, that healing stuff that heals the damaged tissue, the lesion. We need that good flow of those nutrients to the site of the injury, and we need the good kind of removal going the other way from the veins in the lymph system to reduce the inflammation, to kind of get rid of all that removal, the aftermath of the injury. So we need good flow to and fro, there and back. This is compromised when the space is compromised, when you're in poor posture, and other things kind of compromise that space, when there's a lot of inflammation in there. It's compromised due to inflammation, irritation, and even rubbing. Those bone spurs we'll talk about in a second. You don't have that free movement of the joint, muscle, and tendon, and those veins and arteries that you need. Again, poor posture, always a good thing for a lot of these shoulder issues and neuroplasticity, neuro issues, is movement. aerobics, blood flow. The brain needs that. The lesion site needs that to heal. Talked about the kink in the kink in the hose. If somebody's having a distal problem in their hand and you can't figure out what it is, think proximal. What do I mean by thinking proximal? The neck, the shoulder. Is it pinching a nerve, causing some space and flow issues further up? You know, the scalene, the levator, cervically. We talked about that motor vehicle accident. She was a classic one with the whiplash. That may be the cause of the problem. It's not so much carpal tunnel as is a neck issue. Here again is the plexus. This is the yellow coming through the scalenes. This is a key graphic to keep in your mind. All these things we're going to saw last week and today. This is with thoracic outlet syndrome. This is scalenes. This is plexus comes through the scalenes. There's the pec minor, the pectoralis minor right there. It's a tight, tight space. Poor posture, tight pec minor, pinching the nerves, pinching the brachial plexus. That's a key thing to grasp for this class. Here's the questions for today. We're getting into all these. Did you know all these pretty much? Shoulder anatomy. I can get out of this one to the anatomy one. There is a separate kind of voiceover for that. Gets in some key anatomy for that. Not going to go through this in this PowerPoint. If you want more beyond this, the PowerPoint slides of the anatomy, a lot of it's review, some of it is not when it talks about the space and flow with the glenohumeral joint. Definitely check out the voiceover lecture for that, for those of you unable to attend class. And then what we're doing for a class exercise that I would highly recommend doing is drawing in the anatomy. And this is the anatomy you need to know for next week's quiz, or the quiz when you eventually take it. Okay, so here's our dilemma, here's our case for the day. She is a 24-year-old female. She has right-sided neck pain, chest pain, shoulder pain, numbness, and tingling in her right hand. She's an out-of-work cleaner, house cleaner. She's not too active. She likes to spend her weekends sitting on the bed, drinking iced coffee, eating pizza, while texting and binging on episodes of Riverdale. There she is. That's her weekend, binging and eating. Not ideal posture there. She presents with forward head, rounded shoulders. Right shoulder pain at 8 out of 10 pain. Again, this is our measures. We're using the modified FIMS in spring and part of the level assists over the summer. This is our measure now for our big primary measure, levels of pain. 8 out of 10, washing windows. Levels of pain as it connects to function. 7 out of 10 when she reaches over shoulder height, right side of neck pain, chest pain, constant. She also reports that chest pain, as we know, is a red flag. We want to screen out heart issues right off the bat. She doesn't have any cardiac issues, but in real life you want to screen that out. She also reports intermittent skin discoloration in her hand. It's blanching, turning white, and she's dropping things, tingling and numbness running down her arm, general weakness with overhead activities. Anything overhead causes problems, causes weakness, causes pain, causes numbness, blanching, her hands turning white, and her dropping. Her goal is to have no pain, so she can work again. Her symptoms began a year ago, worsening over the last 3 months. What tests should we do? Where would you palpate and why? How would you treat it? Thoracic outlet syndrome. This is the first one we're going to look at. Common thing, usually there's a student every year or so that has this. Posture is a big cause of thoracic outlet. Symptoms, get chest pain, almost sometimes feels like a heart attack. You can get carpal tunnel-like pain. Sensory vascular issues, the numbness, the blanching, upper extremity weakness, especially when overhead. You should start to think, all right, this is our girl here, Brenda. She's got this stuff. She's got the chest pain, overhead weakness, sensory issues, vascular issues. There, right there is the thoracic outlet. This is kind of a bigger view. Comes out of the scalenes, goes under the clavicle, tight space with that first rib right there, and again a tight space with the pec minor. 3 key spots with thoracic outlet syndrome that cause problems, thoracic outlet syndrome. I was mentioning this to somebody last week. Also, remember the scalenes help with breathing. A lot of our COPD, emphysema clients have thoracic outlet just from overusing their scalenes, causing that inflammation and swelling is pushing on the plexus, the brachial plexus. So the first part, the scalene, pinches between the nerves. This is the first one. You can see it more there in that earlier graphic. First site of potential thoracic outlet impingement, could be all 3, but first of any 3 sites that could pinch it is the scalenes right there. Second site, number 2, right here. See that clavicle? There's that first rib and the clavicle, tight space. The artery, the veins coming out of there, the nerves coming out there, right almost squished between the collarbone and the first rib. That is a site of thoracic outlet, potentially 2. And then 3, again a tight space. See it over here, good. Pectoralis minor, tight pectoralis minor from poor posture, pinching it right there. And that nerve pinching from any of those 3 spots could, this be around here, or could be running right down the arm to the hand. Thoracic outlet, kind of a good place to start when you're looking at a shoulder kind of thing, thinking of space and flow, compromised posture. They walk into the clinic, they have poor posture. I'm thinking thoracic outlet right off the bat. They start talking about numbness and pain in their hand and shoulder. And I want to correct that posture to go after that kind of issue. And you want to palpate up in here. Oh, the scalenes are sore. She's probably pinching those plexus nerves coming down. Again, that kink in the hose analogy that may work for you. The kink and the hose more proximal, further up in this case, is the scalenes, the clavicle, first rib, or the pectoralis minor. Major league pitchers get this from all the wicked twisting and torquing they're doing on their arm forever. And the treatment they do for surgery for these pitchers, if they have thoracic outlet nerve pain coming down, they remove that rib. Doesn't really do a lot. They remove that rib. What does that do? Gives it more space and flow. That's what we're looking for, space and flow. We're trying to restore that space and flow with our posture exercises, with the surgery. That's what the treatment really is in upper extremity for most cases. It's restoring that space and flow so the joint can do what it needs to do without getting pinched and irritated. Kinking the hose. TOS, causes, lots of causes. Could be trauma, motor vehicle accident, we talked about that, whiplash, just that wicked spin back and forth, strains, pinches, injures, plexus nerves coming down, and it can cause all this kinds of issues with pain and all that sort of stuff. Repetitive overhead motions, a lot of times people who do a lot of overhead stuff, painters, house cleaners, oh, that's Brenda again, isn't it? She does this overhead stuff. And then, like we've talked about, forward head, rounded shoulders. Rounded shoulders is going to cause tightness here. Forward head may cause tightness in the scalenes there. How do you test it? With the Ruse test, you think, these tests, you can memorize the tests or just kind of think them through. The more you can think them through logically, the better off you're going to be in the long run. You kind of move away from tests and just start doing what you need to do to put them in the position that's going to provoke it. We said overhead does it with COPD. So where they have the shoulders abducted to 90, and then they kind of externally rotate, and you put your hands, you kind of make a fist and go out. We'll do this in lab. This provokes it. It'll cause numbness, tingling, fatigue in the arms. How do you treat it? Definitely the posture. The nerve glides, get a little bit into those. There's also something called nerve flossing, a little more advanced. I mean, some of you may have done that over the summer. Nerve glides, posture exercises, diaphragmatic breathing. Why diaphragmatic breathing? Gives the scalenes a break. So they can kind of calm down. Breathing with your stomach versus your scalenes kind of thing. The stretching, the manual therapy to those key areas, aerobic exercise, get them moving, and then modify activities so they're not doing overhead stuff. These are the posture stuff. We'll really get into this and work when your week 2 work happens. Some of you Friday, some of you next week. Talks about the overused, underused muscles, how you see it, how you address it. Chin tuck, the wall lineup, pelvic tilts, a lot of that stuff we did with Williamson exercises. Doorway stretch. Try all these things in the lab. These are all good things to kind of open up the chest. Here you're compromising the pec minor. Here you're opening it up. Opening up the space. Here you're compromising the scalenes and the plexus. Here you're opening it up, giving it space. All right, so let's go into our amazing treatment box for our TOS. Here it is. All right, so this is all gray, so you need to know it all. And it's pretty much what we just said. Symptoms, the causes, how do you test for it? We're going to do this neuromobility test in the lab. This is a good way to test for it. The RUSE test, we'll get into that in the lab. Those are the 2 big tests. Looking for these are the symptoms, skin color, temperature change. Tenelles. Remember the tenelles, the tapping? You may have learned that for carpal tunnel. You can do it anywhere with this potential nerve impingement. Tap it around those 3 potential areas of impingement in the thoracic outlet, the scalenes, on the clavicle, and definitely the pec minor. See if that provokes it. Sometimes there's even swelling around the clavicle. Definitely the posture. Neck trauma. Be really conscientious of any history of neck trauma. And COPD. These are all common causes, tests of it. How do you treat it? We kind of talked about that. Avoid those. Avoid activities that involve 2 hands in front of you, especially if it's overhead. Texting, keyboarding, because a lot of times you're slouched as you're doing that. Avoid carrying anything over your shoulder. It'll pinch by the clavicle and all that sort of stuff. Backpacks, heavy heavy bags, big jackets, bra strap. Professions that involve ladders and overhead activities. Painters, drywallers, electricians, mechanics, hairdressers. Sleep, kind of sleep on the unaffected side. A good way to sleep is to kind of get that shoulder out a little bit. Talk about this a lot. Kind of abduct a little bit with a pillow. Driving. A lot of students are doing a lot of driving, slouched over that. Get good posture supports, good posture, and bring your hands down lower so you're not so high. Diaphragmatic breathing, the stretches you know about, posture exercises, pec minor stretch. This is probably your biggest weapon for TOS, is the pec minor stretch. First thing you want to do is get them stretching that pec minor. You can do that with the wall stretch there. I can't think of the word right now, but when you're stretching out, doorway stretch, you can get that pec minor, and there's a way to kind of isolate the pec minor even more. We'll talk about that in the lab. Nerve glides. Here's some YouTube videos on nerve glides. There's slight variations you'll find in nerve glides. Doesn't seem to be one super accepted way. They all kind of do the same kind of thing. What do? They stretch the nerve. Believe it or not, you can actually stretch the nerve just like you can stretch other muscles. So these nerve glides stretch the nerve, put it in position where it kind of stretches each one of these individual nerves. Those are all good to do. And then you have to think about later on too. We've started to calm it down, kind of being more aggressive, light resistance stuff, get them back to doing what they need to do. That's the thoracic outlet treatment box that you need to know. This is a good way to assess TOS, to find out where is the problem. You kind of assess and treat at the same time. She goes through these different parts. We'll do that in the lab. Here's the down and dirty essence that you need. Nerve glide, there's some different nerve glides. There's some diaphragmatic breathing, scalene stretch, median nerve glides everywhere. We have all putting nerve glides or on the modules. We'll do some of those in class and in lab, and they're in the Google Sites as well. All right, so that is pretty much TOS. Okay, I'm gonna stop this and then we're gonna do another one if I can find it.